Hi, I'm Jay. I'm a service user volunteer. I was a user of services myself, both mental health and addiction service for about 16 years. I couldn't really change that experience or do anything with it. It was in the past, but it motivated me to want to help others that found themselves in a similar position. So I became a volunteer and I had a placement at a local addiction services in Sheffield. So they kind of pointed me in the direction of the waiting room and said, there are service users, can do something with them. So I attempted to engage them. I did lots of questionnaires, surveys, all manner of things to engage the service users. But they were all really quite dry, and it was always me doing something at them rather than them being engaged with the service. Our clinical director, Dr. Roger Smith, came across patient opinion, and it fell into my lap because I had the role of engaging the service users, so I was fairly sceptical because it was the internet and I wasn't really sure if it was going to work. But surprisingly, I found that our service users and patients found the fact that it was anonymous and third party, and that they were going to get a response, they were going to be heard. There's real motivating factors to be involved in it and to engage with it. It was anonymous, it wasn't going to affect their treatment no matter what they said, and they were free to say what they wanted to. You know, they weren't being asked questions or pointed in a certain direction. They could say what they wanted when they wanted to say it. So there was absolutely no pressure to drive them in one direction or another. Our first lot of postings, as we got them, were all about waiting times and how long it took. They were sat in the waiting room, they'd arrived on time, you know, they'd been waiting half an hour, they didn't know what was going on, they thought they'd been forgotten about. Other people came in after them and seemed to go in before them, so it just generated a lot of anxiety and frustration about the whole process, which was not good for our service users. When we looked at the clinic times and we looked at what was going on, it was going to be difficult to try and change that and make the clinic work to time. People will come in late, people will come in early, people will come in on the wrong day, and all want to be seen. People will go in to see the doctor, need to speak to the doctor for 40 minutes, some people will 5 minutes. So from a management point of view, that was difficult to address that. And when that was fed back to our service users, well, they could understand that, sure. I might come in late or on the wrong day or without an appointment, I want to be seen. The issue wasn't about the fact that we were waiting, the issue was about the fact that nobody told them what was happening. So they were getting anxious and frustrated, didn't know whether they were going to be forgotten about or wait till the end of the day or anything like that. So it was all entirely a communication issue. And it sounds really, really simple, but we wouldn't have known the length and breadth of the impact that that had on our service users, particularly as they're coming from quite isolated, marginalised parts of society, significantly stigmatised by the mental health problems or addiction problems. So we kind of really reinforced, to some extent, the expectations that our service users already had about the way the world thought of them and treated them. And then, after that experience, we attempted to engage them in therapy with a doctor or a therapist. So it completely gave us some real barriers to overcome. So simple, communicating much better, telling people the clinic's running half hour late, go outside, have a cigarette, go and have a cup of tea and come back again. It meant that there was none of that frustration, and our service users felt, yeah, somebody had thought about them and thought about what it felt like to come to clinic and wait and not know where they were going. There was a similar issue post-consultation. If they were waiting for a prescription, they'd come out from the doctor, sit in the waiting room, and they wait quite a bit of time for a prescription. They assumed it was because the doctor was in with somebody else, and they felt that that wasn't fair. You know, well, I've been seen, I can't get my prescription, the doctor's seeing somebody else. Again, everybody's forgotten about me. But our service users didn't understand what was involved, and that producing a prescription wasn't easy. It had to be checked, go through several checking processes, because the last thing we wanted was for our service users to get to the chemist and have the wrong prescription and have to come back. So we drew a flow chart on the wall in the waiting room that explained exactly what was going on and why they were waiting. And as soon as that information was imparted to them, they were okay with it, they understood it. So it was a real big communication issue there, right before people got through the door and got to see anybody. It was causing a lot of problems. Once the service users saw that one, saw the changes, made as a result of their feedback. For instance, we're going to have digital signs, so at a glance our service users can tell exactly where they are, with which doctor, and that's really quite comforting for them when they can arrive at our clinic already in a distressed state. So once they saw that that really worked and that feedback was anonymous and it made a difference and it made a change and they got a response to it, they were really encouraged to engage further. So one of the issues at our clinic was over the uptake of hepatitis B vaccination and hep C screening. We'd targeted people, we'd brought them in, we'd offered them the service, they'd say yes they want it, we'd make an appointment for them and never see them. So through the feedback, through patient opinion, it was all to do with, you know, a week or 2 weeks ahead is a lifetime. And all sorts of things can happen to our service users during that period of time. So we came up with the idea of opportunist clinics, whereby service users were already attending the service for one reason, should have the opportunity to take up all the services, all the other services it offers there and then, rather than asking them to attend the clinic maybe 2-3 times in 1 week. That might be, clinic might be 2 bus journeys from their house, so it's not easy to get there. By doing that, we straight away increased the uptake of hepatitis B vaccination and hep C screen, which is a really, really important change for our service users, a really important public health initiative in its own right, and was increased through the feedback from patient opinion. So all the time, these conversations and dialogues were beginning to take place between the service and the service users in a completely risk-free environment where everybody felt comfortable and nobody was exposed to any unnecessary vulnerability by saying, it's me who's saying this. And the impact on the clinic was enormous, both staff and service users alike. It was really great to see that over 50% of our postings were entirely positive. So that really reinforced for the staff team the good work that they were doing. It was fantastic to be able to relay that information to the staff team and see them really sort of grow from that experience of hearing how the difference they make in the service user's life. Some postings are mixed, a bit positive, a bit negative, some are entirely negative, but every single one of them represents a learning opportunity that's delivered in real time. So this isn't some 6-month survey that's done and a year later you get the results. This is happening on a daily basis all the time. So it really gets our finger on the pulse of what our service users want from the service and what they get from the service and how it can be improved all the time. Because of the trust that our service users had and the way in which they engage with it, much more sophisticated, asking really specific questions. For instance, we had a couple who just had a newborn child. They'd had a bit of a slip-up and used once. They were frightened to death that social services were going to remove their child as a result of this. Would never have come into the clinic and said any of this to the doctor, nurse or anybody because there was this fear. But they could pose that question, well, that scenario via patient opinion, and then be immediately reassured with the response. So that was a fantastic thing that we were able to do via patient opinion that I don't believe would have taken place in any other circumstances, and happily, you know, that couple stayed engaged with the service and progressed with that service. What's really also great to see is the way that sister services who don't use patient opinion but are quite savvy and can see us getting service improvements and can see good practice being identified, you know, picking up on that practice and doing the same as we are, so that good practice spreads out to other services and other professionals hear about it. It's fantastic to see that a sister organisation is doing that. Our commissioners, when we're commissioning services or when we're putting in tenders for bids for services, we can really bring the service user's voice right to the fore so everybody can hear what our service users think of this service and how we respond to their concerns. So it's much, much more service user engagement, involvement. It gives them some ownership over the service and it gives them a part to play in it that otherwise did not exist without patient opinion.